My name is Dr. Harold Emerson. I'm 72 years old, and I've spent over 4 decades working in senior care, helping older adults live with dignity, comfort, and confidence, even in the most private parts of life. And today, I want to talk about something most people are too embarrassed to mention, even though it's affecting millions of us every single day: hygiene after using the bathroom. When I turned 65, I noticed something no one warned me about. Simple tasks, like cleaning myself after a bowel movement, became more difficult. My balance wasn't what it used to be. My flexibility had decreased, and just like many of my patients, I started wondering, is it normal that wiping feels like such a struggle now? The answer is yes, and it's more common than you think. I've worked with thousands of seniors across the country, from independent folks living alone to those in assisted care. I've seen the physical discomfort, but I've also seen the emotional toll: shame, frustration, and fear of losing independence. That's why I'm here, not just as a doctor, but as a fellow senior who understands what you're going through. In this video, I'm going to show you how to maintain personal hygiene effectively without pain, without embarrassment, and most importantly, without losing your sense of dignity. Whether you're facing arthritis, mobility issues, or just the natural changes of aging, I'll share practical solutions, tools, techniques, and simple daily habits that will help you stay clean, comfortable, and confident, because no one, at any age, should have to feel ashamed in their own skin. Let's begin together. Now let's talk about something that doesn't get enough attention, yet it impacts nearly every senior I've ever worked with: how improper cleaning after a bowel movement can lead to serious health issues. As we age, our skin becomes thinner and more sensitive. Our immune system isn't as strong as it used to be. That means even small hygiene mistakes, especially when it comes to cleaning the anal area, can open the door to bigger problems. I've seen it time and time again in my clinic. Poor wiping technique can cause skin irritation, painful rashes, and even microscopic tears around the anus. These tiny tears can become infected easily. For seniors with diabetes or reduced mobility, an untreated infection can quickly spread, leading to more severe complications. And let's not forget urinary tract infections. In fact, I've treated dozens of older women who developed recurring UTIs simply because they wiped in the wrong direction, from back to front, dragging harmful bacteria toward the urinary tract. Another common issue is hemorrhoids. When wiping becomes difficult, some older adults apply too much pressure or wipe excessively, which can worsen inflammation or cause bleeding. In more serious cases, chronic discomfort leads to people avoiding bowel movements altogether, triggering constipation, impaction, and even hospital visits. And here's something I really want to emphasize: relying on others for this task often creates emotional distress. I've had patients in tears, saying, "I feel like I'm losing my dignity." That's why learning to clean yourself the right way, with the right tools, can be life-changing. It's not just about hygiene. It's about independence. It's about self-respect. So what's the solution? There are smart, practical ways to protect your health and preserve your freedom. In just a moment, I'll show you easy methods you can use every day, from using moistened wipes made specifically for sensitive skin, to affordable bidet attachments you can install on a regular toilet in under 15 minutes. We'll also cover safe techniques that don't strain your back or your joints. Because the truth is, good hygiene after using the bathroom isn't just a matter of comfort. For seniors, it's a matter of health and dignity. Stick with me. What I'm going to share next could prevent infections, reduce discomfort, and give you back the confidence you deserve. Let's keep going, step by step. Now, let's dive into one of the most common mistakes I see among older adults: relying solely on dried toilet paper for cleaning. I know it sounds simple, but I can't stress enough how much this practice can lead to hygiene issues and discomfort. Let me explain why. As we age, our skin becomes thinner and less elastic, making it much more prone to irritation. When seniors use only dried toilet paper, it can be too rough on the delicate skin around the anus, leading to rashes, painful friction, and even cuts. These small tears, as I've seen firsthand in my practice, are not just uncomfortable, they can invite infections. And once an infection sets in, it can escalate quickly, especially in seniors who may already have other underlying health conditions like diabetes or reduced immune function. But it's not just about irritation. Dry paper, while effective in a pinch, doesn't do a thorough job of cleaning. Without enough moisture, it can leave behind residue that clings to the skin. This residue can contribute to the growth of harmful bacteria and lead to infections such as urinary tract infections, UTIs, or yeast infections. For seniors, whose systems aren't as robust as they once were, these infections can spiral into something much worse, affecting their quality of life and overall health. Now, don't get me wrong, I'm not here to demonize toilet paper entirely. It still has its place. But let's be clear, it's just not enough for thorough hygiene as we get older. This is where the solution comes in: moist wipes or bidets. I recommend using wipes that are designed specifically for sensitive skin. They're moistened with gentle, skin-friendly solutions that can clean better than dry paper ever could. These wipes are often infused with soothing ingredients like aloe or vitamin E, which can help calm the skin, reduce irritation, and prevent that uncomfortable feeling of dryness. For those who have the ability to install a bidet, this is a game changer. A bidet, which uses a gentle stream of water, can thoroughly clean the area without causing any friction or irritation. Plus, it's an easy way to maintain independence and dignity, especially if physical limitations make it difficult to reach or wipe effectively. Remember, the goal isn't just comfort, it's health. By switching to moistened wipes or using a bidet, seniors can avoid the painful aftermath of poor hygiene practices and keep infections at bay. By taking these small steps, seniors can protect themselves, stay independent, and, most importantly, feel good about their hygiene. As we continue, I'll walk you through how to make these simple yet impactful changes to your daily routine. Let's keep the conversation going. I'm here to make sure you feel informed, empowered, and healthy. As we've seen, using only dried toilet paper isn't enough to maintain proper hygiene for older adults. But the good news is that there are simple and effective solutions to ensure cleanliness and comfort. I've spent years helping older adults navigate these challenges. And now, I'm going to share the best practices for maintaining excellent hygiene, practices that will not only protect your skin but also promote overall health. Let's start with the basics: gentle, thorough cleaning. When it comes to personal hygiene after using the restroom, the key is to use the right tools and techniques to prevent irritation and infection. I always recommend using moist wipes designed for sensitive skin. These wipes are typically free from harsh chemicals, alcohol, and fragrances, making them ideal for seniors. They can clean more effectively than dried toilet paper and are much gentler on the skin, which is essential as skin becomes thinner and more prone to irritation with age. Always choose wipes that are hypoallergenic and biodegradable for environmental and health reasons. For seniors who have difficulty with manual dexterity or flexibility, a bidet can be a life-changing addition. A bidet provides a stream of water to clean the area thoroughly, without the need for excessive wiping. This not only ensures that the skin is free from harmful residue, but it also prevents the friction and discomfort that can come with wiping. The gentle water pressure of a bidet is soothing on the skin, making it a perfect solution for seniors who experience dryness or irritation. If a bidet isn't an option, there are still other ways to improve hygiene. Warm water and mild soap can be a good alternative. I suggest using a soft washcloth or disposable wipes soaked in warm water to clean the area. Gently wipe, starting from front to back to avoid contamination. And be careful not to scrub too hard. A light touch is key to preventing skin damage or irritation. For those who experience mobility issues, using a long-handled wipe or toilet aid tool can make the process much easier. These devices are designed to help seniors clean themselves with minimal bending or reaching. They allow for a more controlled and comfortable wipe, reducing the strain on the body and preventing accidents. After cleaning, it's essential to pat dry the area gently with a soft towel or tissue. Don't rub. This can cause further irritation. Keeping the area dry helps prevent rashes and fungal infections, which are common in moist environments. Additionally, I can't emphasize enough the importance of proper skincare. Moisturizing the skin around the anal area with a gentle, fragrance-free lotion can help maintain elasticity and prevent dryness. Be mindful of choosing products that are specifically designed for sensitive skin. I often recommend barrier creams for seniors who are more prone to skin breakdown due to moisture or friction. Finally, let's talk about maintaining a regular hygiene routine. For seniors, consistency is key. A routine of cleaning after every bathroom visit and moisturizing regularly helps to prevent any buildup of harmful bacteria. It's also essential to monitor for any signs of irritation, such as redness or discomfort. If you notice anything unusual, consult with your healthcare provider to address the issue promptly. By following these simple steps, seniors can keep their hygiene routine effective, comfortable, and health-promoting. Remember, good hygiene is more than just about feeling clean, it's about protecting your skin, preventing infections, and maintaining your dignity. These practices may seem small, but they make a world of difference in your overall well-being. As we continue on this journey of empowering seniors to stay independent and healthy, remember that it's always worth making these small adjustments. Your health and comfort matter, and I'm here to help you every step of the way. As I sit here reflecting on the profound impact of personal hygiene on the well-being of older adults, I can't help but think of the emotional consequences of losing the ability to care for oneself in such an intimate way. You see, hygiene isn't just about cleanliness, it's also deeply connected to dignity and self-worth. For many seniors, the moment they realize they can no longer handle personal hygiene on their own, it's as though a part of their identity slips away. It's an emotionally complex experience, and one that can be fraught with shame, embarrassment, and a profound sense of loss of control. I've seen this firsthand in my years of working with seniors. The inability to perform basic tasks like cleaning oneself can feel like an insurmountable blow to their sense of independence. The simple act of self-care, something most of us take for granted, becomes a source of anxiety and distress. Many seniors struggle with a feeling of powerlessness as they navigate the loss of this personal ability. It's not just about needing help, it's about the emotional weight of realizing that they are no longer as self-reliant as they once were. And that, in itself, can be deeply painful. Imagine the frustration and self-consciousness that come with having to ask for help in such a private, vulnerable moment. For many older adults, this loss of independence doesn't just affect their physical well-being, it impacts their mental health as well. They can feel as though they've lost their dignity. They may become embarrassed, withdraw from social interactions, and even experience depression or anxiety. The feeling of being a burden to family members or caregivers can exacerbate these emotions, leaving them with a diminished sense of self-worth. This is why, as caregivers and family members, we must approach these sensitive moments with great care and respect. It's vital to remember that the process of assisting older adults with personal hygiene should never feel like a judgment or an imposition. It should be an act of support, compassion, and respect for the individual's remaining autonomy. The elderly should feel that their dignity is preserved, even when they need help. This isn't just about cleaning, it's about ensuring that they feel valued, respected, and understood during one of the most personal and vulnerable parts of their day. I have worked with many families over the years, and one of the most powerful lessons I've learned is that communication is key. Family members must be aware of the emotional impact of hygiene assistance. Approach it with sensitivity and understanding, rather than focusing on what your loved one can no longer do. Focus on how you can support them in maintaining as much of their independence as possible. Help them to feel in control of their own care, even when they need assistance. This can be achieved by giving them choices, such as allowing them to decide what wipes or products they feel most comfortable with, or offering them opportunities to manage other aspects of their hygiene routine where possible. The role of the family is incredibly important in this process. It's not only about physical assistance, it's about emotional support. Families should create an environment where seniors don't feel ashamed or embarrassed about needing help. Instead of seeing it as a task, treat it as a way to express your love and care. Offering a listening ear and showing patience can make a world of difference. Don't make them feel as though their inability to care for themselves is a sign of weakness. Rather, remind them that it's just another part of life, one that we all go through at different stages, and it doesn't diminish their worth or value in any way. I've seen families transform these situations with a little compassion. They normalize the experience, focusing not on what has been lost but on what is still possible, maintaining dignity, comfort, and self-respect. For seniors, this emotional reassurance is invaluable. It strengthens their confidence and helps them move forward with greater ease, knowing they have the support of their loved ones. If you're a caregiver or family member, remember that your attitude can change everything. By treating these moments with respect, kindness, and patience, you can help your loved ones maintain their dignity and self-esteem, even during these most vulnerable times. After all, the essence of caregiving is not just about physical care. It's about providing emotional support that honors the person as a whole, both in body and spirit. As we age, maintaining our independence and dignity becomes more challenging, especially when it comes to personal hygiene. Dr. Harold Emerson, with his years of experience in elderly care, reminds us of the importance of approaching sensitive topics with compassion, patience, and respect. It's not just about helping older adults with their daily care. It's about preserving their sense of self-worth and independence. For many seniors, losing the ability to manage their hygiene can lead to feelings of embarrassment, shame, and a loss of control, which can have deep emotional effects. By being understanding, offering support without judgment, and giving them choices wherever possible, we can help preserve their dignity while ensuring their well-being. It's essential to approach these situations with empathy, knowing that our care can significantly impact their mental and emotional health. So, take a moment to reflect on the needs of the older adults in your life. Your support can be the difference between a loss of self-esteem and a continued sense of worth. Share this message of kindness and respect with others. And remember, the small acts of care we provide can make the biggest difference in someone's life. If you found this message helpful, please don't forget to like, subscribe to Senior Moments Matt, and share your thoughts or experiences in the comments below. We'd love to hear your perspective and any personal stories or questions you may have.